post-exposure antibody protection trialed. 10 people have been given antibodies as a form of emergency protection after being exposed to coronavirus, in the first trial of its kind. The experimental jab is being offered to people who have been in close contact with a confirmed COVID-19 case within the past 8 days. If it proves effective, it could protect vulnerable people who haven't yet been, or can't be, vaccinated. The trial, run at University College London Hospitals, UCLH, NHS Trust, is looking at whether an injection of 2 different antibodies could prevent someone who has been exposed to COVID from developing the disease, or at least from becoming very ill. Vaccines take weeks to offer full protection, meaning it's too late for them to be given once someone already has the virus brewing in their system. But this monoclonal antibody treatment, developed by the drugs company AstraZeneca, should work to neutralize the virus immediately. It could mean healthcare workers, hospital patients and care home residents could be given the treatment if they have been exposed to a known COVID case. They are targeting recruitment at areas where people are likely to have been exposed, including hospitals and student accommodation. People wanting to take part will have to show their close contact has tested positive. The jab works by donating antibodies, Dr. Houlihan said. It skips out that stage of your body doing the work to make them. She explained this technique was already used post-exposure for other viruses like rabies and chickenpox in pregnant people. Another trial already underway at UCLH is looking at whether the same antibody treatment could be used before someone is exposed to coronavirus, to prevent them ever catching it. Infectious diseases consultant Dr. Nikki Longley, who is running the pre-exposure trial, said it was being trialed on people with conditions like cancer and HIV, which may affect the ability of their immune system to respond to a vaccine. It might also be useful to protect vulnerable people as a stopgap before they can be given a vaccine, Dr. Houlihan confirmed. Along with UCLH, the antibody treatment will be trialed at multiple sites in the US as well as in Wakefield, Manchester, Southampton, and Hull. The first results for both arms of the trial, using antibodies before and after exposure to COVID, are expected in the spring.